Good afternoon, parents. Hearty welcome to the first workshop by the Little Dentist. This is the first of many workshops to come where we'll help parents in taking care of their child's dental hygiene. Today we have Dr. Kavita Siroy with us. She's a senior periodontist with over 13 years of experience. She has worked with Max Hospital and with various different dental clinics. She has also been with Little Dentist for the past 3 years, and she works as a specialist with kids. Right. Good afternoon, doctor.
Good afternoon, everyone.
So today, topic for today's workshop will be tooth decay in children. What are the sign, causes, and how to prevent them? Right. So, doctor, what are the early signs that parents should look out for when dealing in cavities with small children?
Cavities is the commonest dental problem occurring in infants and toddlers, also referred to as tooth decay, early childhood caries, or baby bottle syndrome. Now, milk teeth are equally important in chewing, maintaining speech. So, yes, it is important to find out the symptoms if your child is developing any dental decay or not. So, now how can the parents find out if their child is suffering from a tooth decay? It usually starts, or the early sign for detecting a dental decay is a white spot or a white band which develops near the gum line. Sometimes this discoloration, it changes to brown or black. That means the decay is progressing. Now, the early white spot is usually undetected by the parents. Another few signs which the child can give is that sometimes your kids are very irritable or fussy without any reason. They could be excessive crying. They avoid eating foods. Then sometimes they find it sensitive or sensitivity to food items like cold, hot, so sweets. Uh, Another is one more thing is sometimes there is a swelling in the mouth. So all these are the alarming signs which indicate a dental decay in your kids. Now, what are the common causes which leads to this dental decay? So plaque buildup on the tooth enamel is a very common major cause which leads to dental decay. Now, what is plaque? Plaque is a soft white matter which develops on the tooth enamel, and it generally develops due to improper brushing or lack of oral hygiene, which is mostly there in the small age group as they are not capable of doing, and most of the times the parents are unaware or they don't know that the brushing has to be started or not. Then the other causes which can lead to dental decay is milk. Yes, milk plays a very important role in increasing or causing a dental decay in child. Now the parents must be surprised how can milk cause dental cavity, because it is a very common food item which is taken by the kids between the age group 1 to 3. Now milk, as you all know, is sweet in nature. So most of the kids at this young age group, they have a practice of feeding at night. It could be the mother's feed, bottle feed, formula milk. So the kids, they have a tendency of, getting up or waking up frequently in the night. So every time they wake up, they need milk. And they have this milk and they go to sleep with the milk in mouth. And there is no activity in the mouth, there is no saliva generation. So there is generally a dry mouth state. So this can lead to dental decay in your kids. Thirdly, which most of the parents are aware, is the sugar or the sugary items like chocolates, candies, which mostly are introduced in this young age group. So these are the factors which can cause to dental decay.
Okay, doctor. So thanks for that information. So how do parents go about preventing these cavities in children?
Yes. So prevention, it starts at home itself. So how the parents can prevent this dental decay is by maintaining a good oral hygiene in their children. Now, in infants where there are no teeth, at that time they can start with cleaning the gum pads. How can you clean the gum pads? You can take a clean wet cloth, wrap it around your finger, and after every feed or meal, make sure that you are cleaning the gum pads. Secondly, once the teeth starts erupting, at that time, initially you can start with a finger brush, which is a silicone brush easily available in the market. And also it is easy to use. You can put it on your finger or wear it on your finger. Gently brush your child's teeth. Once the child is about 2 to 3 years of age, and most of the teeth have erupted at that time, you can start with a soft toothbrush, age appropriate, with small pea-size amount of toothpaste. Now the toothpaste can be a fluoride-free toothpaste in those kids who don't know spitting at all, or it can be a fluoridated kids toothpaste, specially designed for kids in those children who have learned spitting. Even if your child is not able to spit properly, still you can use a kids friendly fluoride toothpaste because it has to be taken in a very small pea size amount. So even if the child is swallowing it, it is not going to be harmful for the child. And the third most important factor is to schedule a dental visit with your pediatric dentist.
Okay, doctor. So, for such small children, when should a parent plan for the child's dental visit? What is the best time to plan for a first dental visit?
Yes. So generally, the teeth starts erupting. The baby teeth starts erupting by the age of 6 months mostly. So this is the right time when you can plan or schedule a visit with your pediatric dentist, or otherwise it could be done by the first birthday of your child. Now, why it is important to schedule a visit with the dentist, with your pediatric dentist, is that they can guide you better as they are specialists generally for the kids. So they can guide you better in terms if any dental decay has started in your kids or if it is in a progressive state. They can tell you about the prevention, like the oral hygiene measures. Maybe if any oral hygiene measure is lacking in your kids, they can guide you on that. If any preventive treatment is needed, like fluoride application, it can be done at the clinic in the initial stage itself so that the cavity doesn't progress and no extensive treatment is needed for your child. Or if any dental filling or any repair is needed, that can also be guided by them. So it is very important to schedule your child's first dental visit and also subsequent 6 monthly routine dental checkups also.
Got it, doctor. Thanks a lot for all the information that you have provided us today. Thank you. Thanks, doctor.
Thank you.